Welcome back to More Health, Less Healthcare. I'm Peter Boland. I want to start with a hard truth. The United States spends more on healthcare than any other rich nation, and yet our health keeps getting worse. Now, that should tell us something. It should tell us that we build a system around care, sickness care, and not around health. Those are two very, very different things, very, very different cultural values. Now, we don't have a shortage of medical services, we have a shortage of health. And that's where this series begins and where our focus will be over the next few weeks. But I want to ask an even harder question. What will it take for our healthcare system to move away from a business model that does best when people stay sick? I'm talking especially to health plan leaders, delivery system leaders, and people who sit at the center of the system. Because we have a glaring contradiction here. We say we want health, but the system still makes money from illness, primarily from illness. And prosperity can't be built on sickness. We know that, we should know that. And a system that depends on illness for its margins will never be fully committed to keeping people well. We might do good things, we launch good programs, we have smart, caring people, we run the systems. But if the model itself still rewards sickness more than health, the system will keep moving backwards towards more treatments, more utilization, more revenue, and even revenue maximization. And that's what we see now. Most of our money goes into sickness infrastructure, hospitalizations, procedures, specialty drugs, high-cost rescue care, after people are already in trouble. And very little goes to those things that make people stay healthy in the first place, like stable housing and adequate nutrition, safe neighborhoods, clean air and water, reliable primary care, and integrated mental health support. And of course, maternal and child health support. Those things aren't marginal, they're central. And when you ask people what they want, the answers are pretty simple. They want to live longer, healthier lives. They want healthy children. They want care they can afford and a system that keeps them staying well. But that isn't what they're getting, and far from it. Instead, they get an industry that takes more and more of their paycheck, more and more of our public dollars and family budgets, and still chronic disease, mental distress, disability, and preventable suffering continue to rise. Now, this isn't an accident. It's the result of three primary drivers: payment, policy, and leadership choices. We pay well for rescue care, but we pay poorly for prevention. And that's really the issue before us. And we spread accountability across thousands of organizations throughout the country that act surprised when no one seems responsible for community health. When we talk about value-based care as a solution, but most of the money still flows towards volume, admissions, episodes, and service line growth. And when savings happen, consumers don't feel it. So if you run a health plan, a hospital, or integrated system, you're sitting right in the middle of this tension. You lead institutions that matter deeply to community well-being, but the financial incentives are mostly rewarding activity or outcomes, margin over meaningful metrics to consumers, and utilization over health. That's why leadership has to become more than just managerial. It has to become stewardship. And stewardship has a fiduciary responsibility to supporting health and not just sickness care. Simply put, we're not going to be able to create more health until we reduce our dependence on high-cost sickness care. Not by rationing or withholding needed care, but getting serious about waste, overtreatment, fragmentation, and failure to prevent. We need to move real resources, not just money, but attention, time, talent, and reputation away from low value utilization and towards tangible health creation. And health creation isn't abstract, it's concrete and it's investable. The other 80% make people well. It looks like affordable housing, stable work conditions, good maternal health, strong support for infants and children, accessible behavioral health, and communities where safety is normal rather than a rarity. And these aren't side issues, they're the conditions that shape health. Yet healthcare still spends as if health itself sits outside of the business model, which makes no sense. It has to sit at the center of the business model. So, throughout this podcast series, I want to keep asking a few basic questions. What matters most to people who pay for care? Patients, families, employers, and taxpayers. And how often do our decisions actually reflect their priorities? Admittedly, these are hard questions to answer, and we're not used to asking hard questions and then being held accountable to customers and taxpayers for delivering on them. Said another way, what would it look like to make a true generational commitment to health, and not just a quarterly commitment to utilization targets and earnings? What would it mean for the healthcare system to recover from its dependence on sickness care revenue? And how do leaders build governments and financial incentives and accountability around consumer and community well-being? We don't ask these kind of questions. And if we want more health, we're going to have to ask these questions and deliver on them. These are important questions. And that's exactly why I'm going to showcase maternal health in the coming 3 or 4 episodes, because maternal health is a test. It's the ultimate test of whether we're serious about building more health. Now, maternal health, I believe, is the canary in the coal mine for the healthcare industry and for society. Because if we can't get maternal health right, we're not going to get the other social investment challenges right either. It starts with maternal and infant health. Said another way, if we can't protect mothers and infants, we're never going to solve housing and food insecurity and neighborhood safety. So maternal health, it's not a charity issue. It's not just a community benefit issue. It's a balance sheet issue, a strategy issue, a leadership issue, and a moral issue. If we fail here, it's hard to claim we're going to be serious about building an economy of health and at scale. So that's where this series is going to begin. We're going to look at the hidden tax on motherhood, the policy case for maternal health, and what stewardship and targeted implementation steps require. Because the larger question is bigger than just maternal health itself, I'll be showcasing these issues in Substack articles as well in even greater detail. So again, the larger question is, can American healthcare move from profiting off sickness primarily to creating value from health? Can it stop extracting from vulnerability and start investing in the conditions that help people thrive? Can leaders build something different? Well, I think the answer can be yes, because our organization is already moving in that direction. Not perfectly, but meaningfully. And that matters because it shows there are alternatives. We do have answers, we do have solutions, and they're within our grasp. And that's what More Health Plus Healthcare podcast is about. It's not just going to be a critique or a diagnosis, we'll have plenty of that, but the search for better business models, better metrics, The bottom line is and better results. Now, let's sum it up by saying that a different business model has to create health with a clear focus on consumer value, not just creating organizational value, but consumer value. And that means taking stewardship seriously. The real measure of success is whether people and communities are better off as a result of all of our efforts. So in the coming episodes, we're going to going deeper and deeper into maternal health. Again, I'll be outlining this within the next few episodes on my Substack contributions as well. We have a moral obligation as well as a financial obligation to make it right, both as a society and as an industry. So thank you for listening today to More Health, Less Healthcare. I'm Peter Gold.